Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert here today with my most excited and I know relieved that you got out of work co-host, Dr. Millicent Rovelo, because I know you were battling the banks today.
Yes, thank you very much. Happy to be here. It was one of those days where I was literally battling the banks. I would rather have been operating, but instead I was doing like bank work. And I'm glad that you got me out of that and you made me have some wine, which I'm enjoying here because I think you realized that I needed it.
Well, this is very fancy wine.
Because we are very fancy people and we're talking about a very fancy topic.
We do. We have a fancy topic today, so we have fancy wine for the fancy topic and fancy people.
And what are we talking about today?
It's something that came up for me over the past few weeks after seeing some issues with billionaire plastic surgery.
Ooh, so we're talking about billionaires, people
Right.
with oodles of money
Right.
who go on to get plastic surgery that is not great.
So this is the topic for me is just because you're a billionaire doesn't mean that you have to have bad plastic surgery.
Which is a bit of a head scratcher.
Right?
Like everyone else is like, like why wouldn't you have like amazing plastic surgery?
But it happens
if
all
you're
the
a billionaire?
time.
It
It
does
happens all the time, right? You know who you are. You know who you are, right? And by the way, everybody who's listening knows who they are.
Knows who they are.
So if you know who you are and you're listening, here's your opportunity as a billionaire to learn how to have good plastic surgery. This is the billionaire's guide to getting good plastic surgery.
I love it. And I personally can think of several reasons why I know that this happens, and I'm sure that you have your own reasons. But let's kind of go through why this happens, because it is a head scratcher. Most people would think that if you have all the resources in the world, why would you not have amazing, off-the-wall, stupendous plastic surgery? And there are those that do. And you probably don't know who they are because the plastic surgery is just that good. But then we all know the people that are out there and we see them on social media and on TV and we all go, ooh, what happened to them? And these people have all the resources. So how did they get to this position of having plastic surgery that does not look great? Like, why would that be?
So if you're like a normal person, you're listening to this, I guarantee you that like if you're not a billionaire, but you want to have plastic surgery, you'll have a methodology of going about it to get to the right person for you to get good plastic surgery.
Starting by listening to plastic surgery podcasts.
That's right. Well, that's what we're hoping here, right?
You're doing your research.
Right, but the billionaires don't have that time.
They
don't have the
don't.
luxury of time to learn who's going to really do something good for them. They are, and this happens even for non-billionaire, high-level celebrities that are very
High-level
wealthy,
executives,
everything.
yeah.
The high-level execs, exactly.
Yeah.
And there are just so many ways that you can avoid getting bad plastic surgery. But what happens for typically these billionaires is they assign somebody to the task. Who's going to find out who's the best? How? And I know because I get the calls in my office from assistants
Yes.
that say, I work for so-and-so. She's flying from China. This is what's going to have to happen. She has 25,000 people that work for her, blah, blah, blah. This is what the deal is. Can you accommodate that? I said, of course, we're a celebrity, billionaire friendly. We take care of these people all the time. And of course, you don't know who I operate on because they never find out about that. And it's not the bad plastic surgery that everybody likes to talk about. So what happens is the assistant does the research and goes to them and says, this is who you're going to.
1,000%. And I was going to say that's what happens because these are the stories that I hear from like friends and acquaintances and people I know is like, I sent my assistant out to go find out who the best person is to get like even just fillers or Botox from or who's the best plastic surgeon to do like a nose or a face. And it's like, first of all, this executive assistant probably has a gajillion other things that they're doing for this person already.
1,000%.
This is on the list. It is not probably the high priority. And it takes a lot of time to really go through and find the right plastic surgeon for any given person. And when you have 20 other things you're trying to do with your day, you're not going to be spending that kind of time, number
That's
one.
right.
And number two, you don't really know what you're looking for.
Nope.
And you're not the person who needs the surgery, and you're not going in there with a consult. So there are so many places where this disconnect happens. But I think one of the big ones that I see is this farming out and delegating the research of the plastic surgeon to a 25-year-old assistant.
Right.
You know, like, what do they know about what a good facelift looks like?
They're not even looking for that. They go right to the celebrity-style plastic surgeons. I mean, remember I was on Elizabeth Vargas's podcast talking about her plastic surgery, where she had seen, 4 or 5 celebrity plastic surgeons in Beverly Hills.
Like, what does that even mean? Is the plastic surgeon themselves a celebrity?
Yes.
Or do they operate on celebrities? I was always very unclear as to what that actually meant.
No, they see themselves as celebrities. So she went to the celebrity plastic surgeons. They're on TV. They're on, this TV show, or they're on this or that, or they've operated on this person or that person. And she said, and none of them could help her. And they said, this is a big problem. You need to go back to the surgeon who did it. We can't help you. And they didn't want to. It was a hard, impossible situation. And she said, why do people waste their time with people that are more interested in how they look on their magazine cover, rather than the cases that they're doing? The plastic surgeon is more concerned with their, their photographs of themselves and, what their next, appearance is going to be and when they're doing the Today Show or whatever. And she goes, these guys really spend a lot of time like worrying about themselves. How are they going to worry about my case? And she came and saw me on a Friday and said, this is going south. I go, these implants are going to be out by next week if we don't do something. We fixed her on Monday or Tuesday, and, she's been fine ever since. And she said, like, how is that even possible that, and she said she was referred in by 5 separate people to a surgeon she'd never heard of, me, and everyone said, well, Jay Calvert can fix that. Well, Jay Calvert, he can fix that. You go to Dr. Calvert, he fixes things like that. That's what he does. And she's like, no one would even know that to go there except that I had referrals from 5 people that you fixed that were in my circle. And
that is the key. I think getting those referrals from people you know, who you trust, who either have had plastic surgery by this plastic surgeon, or who just knows of them in the community. Now, that being said, if you're being referred to somebody by a friend or a colleague who had plastic surgery, make sure you like their results. Don't just go because they said to.
100%.
So still a little bit of a critical eye. But I think also what happens is sometimes big name celebrities or just people in general don't want to let others know that they're going to have plastic surgery or that they're shopping for a plastic surgeon.
That's right.
So that is a lot of times how the assistants end up with the jobs, because those are the ones who sign the NDAs. And so they don't really want to get out there and be too public that they're looking for this information. But that is where that information is so crucial, getting those referrals. Because yes, anybody can do a Google search or, a social media search or an Instagram search.
Or ChatGPT.
Or ChatGPT. Who's the best plastic surgeon? And ChatGPT is going to cultivate all of these sources like Instagram and TikTok. But that doesn't mean that that person who has oodles of followers or who's all over the place on TV is, like you said, super focused on the care. Not to say they can't be, mutually exclusive. They can coexist.
Of course.
But just because one is super famous or a celebrity plastic surgeon does not necessarily mean that they're going to get great, outstanding results. And so that's where that's where I think the referrals are super, super helpful. Go to a trusted source.
But what do the billionaires do? They don't have time for any of this. They're on private jets. They're on yachts. They tell their assistant, handle this. And the last thing the assistant wants to do is let them down. So they're going to go to all those big name celebrity plastic surgeons and say,
that should be a sure bet.
This one did this facelift or whatever. But, who knows for real, right? And who even knows what they're even looking at? They don't understand the nuance of what can be done.
No, and what boggles my mind is I've come across multiple people at these high levels, celebrity names you would know, who have gone and gotten plastic surgery by surgeons that aren't even plastic surgeons. Mm-hmm. Like, it's not even that they went to a plastic surgeon and didn't get a good result. They went to like a gynecologist or a, obstetrician or a family practice doctor or someone that's like not even a plastic surgeon. It's like, how did you get to that person? Like, how, with all of these resources, did you not even get to a plastic surgeon?
So there was a case that came over my desk as an expert witness, which I refused to do because I knew the gynecological surgeon that did the liposuction on this huge name celebrity. And I'm not going to say who it is, and I'm not going to say which courthouse it's in because it's in a lawsuit now. And this case it's so ridiculous. If I told everyone about this case, which I don't want to do out of respect for the massive celebrity who've had to file this lawsuit, they would be like, how on God's green earth did this person get this operation from this gynecologist and get this horrific, destructive operation done to them? You would be like, what? How does this even come close to happening?
Right.
There are all these amazing board-certified plastic surgeons
literally
right in front of your face.
Right here.
Right in front of your face. They are right there. And it's like, and this person with huge success, an amazing body, gets bad plastic surgery from somebody who's not even a plastic surgeon.
It's mind-boggling.
It's mind-blowing. It is like, and the public is probably listening, all of our listeners are probably just like, that can't possibly happen. Well, I can assure you it does.
It totally happens.
And it happens all the time. It's happened today. Today, somebody got some kind of crazy-ass operation from a person who's not even certified to do it, who doesn't have hospital privileges to do it, and they're going to have a bad result. I'm going to keep it clean here on this Beverly Hills Plastic Surgery podcast. But the reality is that these people with all the resources can't find the person, and they are enamored by the panache of the marketing and the other celebrities that have gone there, maybe, who they've taken photos with and have videos of them hanging out with, and it's bizarre. It really is. And in the end, what matters are the results.
Right. And then the other thing I think that happens too, so like say they start having their plastic surgery, and maybe they do have a few good plastic surgeries, but the other thing that happens is that it's sometimes hard to know when to stop and when to say no. And when you have, the average Joe out there may or may not have some limited resources. Like the resources are not overflowing and unlimited. So there is a natural stopping point sometimes. Or there's people in their lives that say, that's enough, you need to stop. But when you have unlimited resources and you are surrounded by people whose main job, whose life dependency is making sure that you feel good about yourself at all times, they're not going to say no to you. They're not going to tell you that's enough. And it's even as a surgeon, when someone comes to you and pressures you and wants to pay you and give you money to do a surgery that might not be best for them, sometimes it can be hard because they're just like, I really want it. And they're just like, why can't you do this for me? Can't you do this for me? I know you could do a good job for me. Don't you think you can help me? Can't you do this for me? I'll pay you. And when you have this person with this like aura and A-list celebrity status offering to give you money and wanting you to do their surgery, sometimes it's hard as a plastic surgeon to say no. There's a lot of pressure. So I think sometimes it's that they don't know when to stop, or there's no one putting any guardrails against them. And that's when people start looking really strange.
Ross Musgrave was, RIP, was I think the first president of ASPS. And he was a Pittsburgh guy. And, for all you out there who don't know me, I trained at the University of Pittsburgh, and it is the behemoth training program for plastic surgery in this country. It was then and continues to be today. And Ross said something very, very important. He said, you will make your reputation on the cases you do not do. And
Yes.
I can tell you so many times in my career so far, where I've said no. And I will tell you that there was one very, very famous celebrity, and I'm not going to say who made the referral, and I'm not going to tell you what the problem with their nose was, but they had big problems with their nose. And so maybe you can triangulate it. And I got a call like, are you willing to see this person about their nose. And it was in 2008 or 2000, maybe in 2006. And I said, that's not a referral I can handle at this point in my career. I said, I just can't do that right now, because I knew that this was going to be like that other surgeons with big names and big reputations had massive problems
Tried and failed.
with this celebrity that had cost them reputation points, big time. And I just said,
No.
that's not a good idea. And thank you, but no thank you. And I think that was a very huge move. And I see people all the time that I just say, I don't think this is a good idea. This isn't what we should do. And so the problem is that there are plenty of surgeons, and I always tell people when I tell them no, I go, listen, you'll find somebody who will operate on you. You just show them the money, they will operate. And I just think you need to be in a position to understand that that's not a good thing for you, because somebody will say yes.
Somebody will say yes.
I'm
And
saying
it might not
no.
be because they're money grab or fame hungry. Like, a lot of us generally want to help people, or we want to do
That's
something
right.
to make them happy, or we're people pleasers. And it's not always that you're a fame, hungry, money hungry person. It's like someone comes to you and asks you to do something for them. Most of us are like, I kind of want to help them. Like, I can do something. So it snowballs on itself for
does.
sure. But
It
yes,
does.
no matter where you go, there will always be somebody who will eventually say yes to what you're asking them to do.
No doubt. And I can tell you that, the taking care of the billionaire patient is it's usually very simple, quite honestly. And I have many of these. Like, there was, I think one year we were looking at the Forbes, 400, richest people in the world or whatever, and I had like an actual percentage of the patients.
Oh, wow.
of the people were my patients, and I said, to the team, I said, like, this is interesting. Like, look at all these, people that we take care of, and we take care of them like they're, like anybody else. There's nothing to them.
everyone's
They're
the
pretty
same.
straightforward.
Yeah.
But they like things done in a certain way that, you just want to know that, like, they're getting the best and that things are safe. They want safety first. They want to know that you're actually really good at what they do. And I think it's when they don't ask those questions that they wind up, and that's a lot of times why they wind up with me, because I'm a revision rhinoplasty specialist. And so I wind up with a lot of these people after they've gone to the assistant's recommendation and things didn't go very well. And, when you're that person that doesn't have time to be dealing, and by the way, no one has time to be dealing with complications of a rhinoplasty or a facelift or the breast stuff that
Or
I do.
even the research that it takes to find that good person in the beginning.
Nobody has time.
Nobody has time. But those of us that don't have assistants make the time.
That's right. And so, I just tell them that, look, it's still surgery. Things can still go wrong. Obviously, you've stacked the cards in your favor by finding somebody that does this stuff all the time. So I think, just in terms of the messaging to the billionaires or their assistants, whoever's listening to this podcast, like, go to the next level. Don't just say to yourself, well, this person operated. Like, I mean, even for me, like, I mean, people say, like, I've had patients that said, like, oh, you operated on Terry Dubrow, like, you must be really good. I was like, well, that doesn't mean anything. It just means Terry believes I'm really good. And maybe he knows that I'm really good for him because he is a plastic surgeon, et cetera. But it doesn't necessarily mean I'm the best surgeon for you, and so that's where I think you have to go to that next level and really look at the results and look at what you're trying to achieve, and are you lined up with the right person to do this? I mean, when people listen to that story about the gynecologist wrecking the body of an A-list, Hollywood movie actor, and now there's a lawsuit about it, they're gonna say to themselves that can't possibly happen. And so just realize that it does.
Yeah.
There are what, 7,500 board certified plastic surgeons in the country, and there are 55 or 60,000 doctors that say they are plastic surgeons.
Right. Do the math.
So what is the percentage chance that your surgeon is actually a board certified plastic surgeon and not certified by a board that is not an ABMS, American Board of Medical Specialties board? And it's very hard to get the right person, but we all see the results on TMZ. We all see these bad operations and results wind up being, the fodder for, like, these, magazine shows to say, like, what happened with so-and-so's face, And it's like, well, I can tell you, somebody didn't do their homework and somebody didn't communicate properly. And I'm sure they paid a ton of money. Like
just because you paid a ton of money,
yeah,
it doesn't mean anything.
That's been, well, I saw so-and-so and they were so much more expensive than you. So I'm going to go there. That came up. I'll never forget that. That was oh my God, that was a long time ago. My coordinator was, had to be 2009 because of who the coordinator was, or maybe 10. And the patient came in for a rhinoplasty consultation. And at the time, let's say it was like $17,000 or something like that for a primary rhinoplasty. And, now primary rhinoplasty is, $30,000 or $40,000 depending. But, at that time, we gave, my coordinator gave her the price quote for $17,000. And she had seen, a celebrity plastic surgeon in Beverly Hills also who they were considering going with. And the mother of this, Beverly Hills High teenager said, well, you must have forgotten Dr. Calvert's fee. And she said, what do you mean? Well, $17,000 for this operation?
It's just OR anesthesia, right?
And she said, well, we saw Dr. So-and-so and it was $83,000. And my patients were billionaires, of course. So they, this other surgeon saw them coming and said, well, this rhinoplasty in 2011 or whatever was $83,000, which was, 6 standard deviations off the mean of what people were charging for a rhinoplasty then. And she said, no, this is what Dr. Calvert charges, and he doesn't change his fees based on who's in front of him. Right. The fee is the fee. And she said, well, we have to go with him. He's so much more expensive. He has to be better.
He must be the best.
And he up her nose so badly, And she came back with her tail between her legs and said, I need a revision. She got a rib graft a year later. And, that's the problem, right? It's like, well, it's so much more expensive. It has to be good. That's not necessarily the truth.
That's really not the truth.
And we could do a whole thing on, celebrity surgeon facelifts right now because, I find that, making these pretrichal cuts all over the forehead is not attractive. But the guys that are charging $250,000, $300,000 for facelifts are making these, crazy incisions and cutting off the sideburns and throwing them away. And people are going there because it's so much money. It has to be good. Crazy.
Not necessarily.
So just because you're a billionaire, you can listen to this and you can get some insight. You don't have to have bad plastic surgery. I promise you. Go the next level, and you too, just like us average Joes, can get great plastic surgery by going to the right people. I promise you that.
Yes.
Does that make sense?
Yes. Yes.
Do you have anything else?
No, that's it.
All right. Well then, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.